Welcome students. This is a new class for clinical toxicology. Especially I want to give this class for 4th year Pharm.D students. I have been having a rich experience in toxicology, in teaching for more than 5 to 6 years in United Nations program in various universities for applied toxicology, clinical toxicology for medicine students and paramedical students and health officers. So I feel I can share my experience and also the lecture according to the syllabus. If I go, it will be useful for my students. For Pharm.D students, 4th year, they have this clinical toxicology, a very, very valuable and important subject which gives us more application in the clinical pharmacy or in clinical practice of the Pharm.D students. So this is specially made for the 4th Pharm.D students, and it will be useful for other pharmacy postgraduate students also, for their any various examination point of view, entrance exams, for their public service exams. It will be useful. Here I am going according to the syllabus of PCI and COHAS. Clinical toxicology, the lecture 1, I have taken only the general principle involved in the management of poisoning, because before going to the subject, the student should know what is toxicology and what all toxins, various possibility of how to manage a patient in general if they get poisoned or get poisoning. So that's why I took a lecture for giving the important. Even this one also asked many times, 4 or 5 times they have asked essay question also, general principle of handling poisoning of patients. So toxicology is the aspect of pharmacology that deals with the adverse effect of drugs. So clearly the students should know that adverse effect of the drug. It is considered or it is concerned not only with the drug used in therapy, but also with many other chemicals that may be responsible for household, environmental or industrial interactions. The word toxicology is derived from toxicon, a poisonous substance into which arrowheads in ancient times, arrowheads were dipped in toxikos, and a bow to kill the enemies, as shown in the picture. The bow and an arrow, you can see the bow will be dipped with toxicon. And even spade also they used to dip in toxicon. So the study of poisons must have started by 1500 BC, because the Ebers Papyrus, the earliest collection of medical records, contains many references and recipes for poisons. Parassala is a scientist which, whenever we talk about toxicology, we have to remember about Parassala. Summarize the concept in the following famous phrase, and it was not accepted in his time: all substances are poisons. There is none that is not a poison. Why he mean is, even people can die with oxygen, people can die with water. After some period, after his period only, people got understood about the dosage. The right dose differentiate a poison from a remedy. So dose makes whether it is a food or it is a drug or it is a poison. So Parassala, the scientist, this concept of Parassala is especially crucial to the safe use of drug, but also important for the safe handling of other chemicals. Types of toxic substances: drugs, food additives, industrial chemicals, environmental pollutants, natural toxins, household poisons. So types of toxic substances: first, drugs. It's in our subject. Drugs have usually been designed to be highly potent in biological systems, and consequently many are potentially toxic. Drug toxicity may be due either to a overdosage or it may be a rare and unusual adverse effect, undesirable effect, unexpected effect, adverse effect. There is a difference between adverse effect and side effect. You know that. Side effect is a parallel effect. May be useful, may not be. But adverse effect, undesirable effect, unexpected effect, unusual effect. Overdosage can cause, and also you can see adverse effects can also be seen. So number 2, food additives. Food toxicity is in our syllabus. It is in this chapter. In this next chapter is that one. So food additives are usually of low biological activity. Many different additives are now added to the food to alter the flavor, to alter the color, prevent the spoilage for storage conditions, or in some way change the nature of the foodstuff. So there are also many potentially toxic substances which may be regarded as contaminants occurring naturally in food, resulting from cooking also or from other contaminations also. Number 3, industrial chemicals. Many cities are finding that difficult by the pollutions. So industrial chemicals may contribute to environmental pollution, and they may be a direct hazard in the workplace where they are used to formulate it or manufacture. Environmental pollutants. The main source of pollution are industrial process and the deliberate release into the environment of the substance such as pesticides. The most visible pollutant, but perhaps not the most significant, are smoke from a power station and factories. Factories may also produce and emit more potent substance in smaller quantities, although the level of these is generally controlled. Environmental pollutants may be released into the air, river, seawater, and sometimes dumped on the land also. So number 5, natural toxin. Many plants, animals produce toxic substances for both for their defensive and offensive purposes. Natural toxins of animal, plant and bacteria origin comprise a wide variety of chemical types, cause a variety of toxic effect, and are a significant cause of human poisonings. Natural poison even including venoms. Number 6, household poisons. These are include some of the substance in the other categories such as pesticides, drugs and solvents. Common household poisons are also there. Exposure to these types of compounds is usually acute, immediate, rather than chronic. Many of the household substances used for cleaning are irritants, and some of them are corrosive to the skin. So what is poison? Poison means dose related, according to the Parassala, dose related adverse effect. Adverse effect means dose curve. You might have studied in pharmacology. Dose curve. Dose. The benefit dose, harmful dose. That means minimum effective concentration. When it is increased in the blood, response will be toxic. Toxicity, the test dose or the prevent susceptibility. You can see the graph. So dose related adverse effect, exposure to chemicals or drugs or other xenobiotics, foreign substance or other xenobiotics. So it can be, you can see just now we have discussed, it can be from the beverages, chemicals which we are using, cigarette smoking, and also it may be from industrial pollutants, smoke from a car, paint, many things, whichever may be toxic pollutions coming to the air. Now we are going to talk about poisoning and drug overdosage. I am just jumping directly to the examination point of view. They are asking general poisoning and drug overdosage general, because we have to see one topic separately, but general they are asking 10 mark question, means students should know what we have to carry out the poisoning patient coming to the clinical level. Poisoning and drug overdosage. Poisoning refer to the development of dose related adverse effect following exposure to chemicals, drugs or other xenobiotics. To Parassala or the paraphrase or the phrase which is given by Parassala, the dose makes the poison. The dose makes whether it is a food or a drug or a poison. In exclusive amount substance that are usually innoxious, such as oxygen and water, can also kill the person and cause poisoning. Oxygen toxicity, you see, sign and symptoms like he will get irritation, seizures, pain, muscle twitching can also be seen. Even you can see the symptoms of visual disturbance, cataract formation, bleeding, cough. These all are some of the poisoning of oxygen. Symptoms of water intoxication, headache, confusion, irritation, muscle weakness, drowsiness, nausea, vomiting, bloating in the stomach. These all are coming from the water itself. So dose mix, whether it is a food or a drug or a poison. Conversely, in small doses, some of them, even though it is known poison like arsenic, cyanide, they are highly poison. But in small doses, they are not danger. So that's what. In small doses, substance commonly regarded as poison, such as arsenic and cyanide, can be consumed without ill effect in very micro doses. They are very poisonous. So you should know the word hormesis. What do you mean by hormesis? Hormesis, you can say. Hormesis is a biological response where low doses of a substance are beneficial while high doses are harmful, just now as we told about arsenic and cyanide. So you can see that low dose, cell in low stress, adaptive response and repair the mechanism in low dose. But if it is a high dose, slightly increased, cell is high stress and cell is damaged and cell death will take place. So you should know some of the words of definitions. In this case, xenobiotic we came many times. What is xenobiotic? Foreign chemicals do not generally contribute to the body growth or enter any pathways for eventually production of energy. So they are called as xenobiotics. Potency means what? We know that potential of the drug. Potency of the drug will be high, means by standard relationship between incident or intensity of an effect of a drug and dose required to produce effect, used as a standard for comparison of different chemicals. What are harmful or adverse effects? Harmful effect, undesirable effect, adverse effect are those that are damaging to either the survival or normal function of the individual. Side effect, I told they both are different. Side effect generally expected effect, parallel effect may be useful, may not be sometimes. So however, some side effect can be unexpected also. Adverse effect usually is unexpected effect. Unwanted effect comes as an unpleasant surprise. And when we come to a definition of what is toxicity, you should know toxicology means what is toxicity. The word toxicity describes the degree to which the substance is poisonous or can cause injury. The toxicity depends on a variety of factors: dose, duration, the route of exposure, shape and structure of the chemical itself, an individual human factor. So that you can see that what is, whether it is neurotoxicity or genetical toxicity or hemotoxicity or nephrotoxicity, or it is reproductive toxicity or ocular toxicity, like that it can be determined. So what do you mean by toxic? The word toxic, when they say what is toxic, the term related to poisonous or deadly effect on the body by inhalation, breathing, inhaling or ingestion, eating something, toxic substance, or absorption, or by direct contact with the chemical. This is about a plant. So we say toxin naturally. So toxin, toxicant, there is two words are there. Toxin means which is from usually is used when taking about toxin substance produced naturally. A toxin is a poisonous substance of microbial, bacteria or other tiny plants or animals, vegetables, or even sometimes synthetic chemicals also, they used to say toxin, which reacts with specific cellular components and kill cells, alter growth relating activity or development, or kill the organism. So you can see toxin versus toxicant very clearly. Toxin means naturally occurring. Simply the student can have an idea. Naturally occurring bacteria, fungi, plants, insects or algae. Toxicants means manufactured or man-made chemicals, particularly for cleaning purpose and which is available the industrial purpose which you are produced by the man-made. So what is toxicant? A toxicant is a chemical that can injure or kill humans, animals and plants. A poison, the term toxicant, is used when taking about toxic substances that are produced by or a byproduct of the human made activities. So poisons or poisoning, you can just categorize. This is simply made by me, that is accidental exposure poisoning, intentional exposure poisoning, for suicidal attempt, intentional or habitual, unintentionally poisoning, a person innocent, unintended poisonings, drug related fatalities, overdose, mistakenly taken, implicated in fatal poisoning. So these all things we can just have. An accidental exposure means can result from the improper use of the chemicals at work or in play or use. The product mislabeled by the manufacturing, mislabeling, label misreaded, mistakenly identified, unlabeled chemicals, simply bottled without label, unformed or uninformed, that for example, not uniform, uninformed self-medication without discussing with the physician, without discussing proper pharmacist, and dosing error even by nurses, parents, pharmacists, why not physicians, and by the elders. These all are accidental exposure. Excluding the recreational use of alcohol, recreational small dose of alcohol using, attempting suicide, more drinking, more taking alcohol, attempted suicide is the most common reason for intentional exposure. Unintended poisons may result from the intentional use of drug for psychotropic effects, abuse. There are many psychotropic drugs, drug abuse, or excessive self-dosing, misuse of the drug. Drug-related fatalities are most common due to analgesics, antidepressants, sedative anticonvulsants or sedative hypnotics, neuroleptics, stimulants, cocaine, caffeine, amphetamine, and street drugs, cardiovascular drugs, anticonvulsant drugs like phenytoin, sodium valproate, and antihistamines, and asthma therapies. Non-pharmaceutical agents most often implicated in fatal poisoning include alcohol and glycols, gases and fumes, chemicals, pesticides, cleaning substances, automotive, car, bike, automotive products. General principle involved in the management of poisoning. General principle. The clinicians, clinical pharmacists, PharmD students should know this is general. We are going to study detailedly about every diagnosis, every treatments. But this is general I have given. First, diagnosis. Second one is treatment. Third one is supportive care. Fourth one is prevention to poison absorption. Fifth one is enhancement of poison elimination. And sixth one is other techniques. So these main points, there are many sub points are there, but still we will go for diagnosis. Starting from diagnosis. Diagnosis usually, first one is history. If there is no history, then only the diagnosis goes very fast inside. History is there, it will help you for identifying which poison have been taken by the patient. We can undergo for the treatment. So, first history, physical examination, third one is laboratory assessment, and the fourth one is radiologic studies, and fifth one is ECG, electrocardiogram, and sixth one is analysis of urine and blood, and seventh one is response to antidotes. This can be done in the first initial diagnosis. So what do you mean by history? Although the poisoning can mimic other illnesses, the correct diagnosis can usually be established by the history, physical examination, routine and toxicological laboratory evaluation, and characteristics clinic sources. So the history will give you lots of help. The history should include the time, route of administration, duration, how long, and the circumstance, location, surrounding events and intent, the exposure of the chemical, exposure of the substance for poisoning, the name of the poison, the amount each drug, chemical and ingredients which is involved, if it is a multi or if it is a combination, the time and the onset nature and the severity and of the symptoms. Severity of the symptoms should be noted. The time and the type of first aid measure which is provided in the place where the person have been get poisoned, and the medical and the psychiatric history. These all history is needed. In the absence of history, it's the biggest issue actually. But in the absence of history also you should undergo for the treatment. So of exposure, the clinical course may suggest a diagnosis of poisoning. So that is the next one. Physical examination. The physical examination means should focus initially on the vital signs of cardiopulmonary system and neurologic status. On the basis of pulse, blood pressure, respiratory rate, temperature, body temperature and mental status and psychological stage can be characterized as excited, whether it is excited, depressed, decolorant or normal. You can see this very important for the person to know about the temperature, blood pressure, bowel sounds, eyes, lungs, heart rate, skin, examination of the eyes for nystagmus, pupil size and reactivity, abdominal, bowel activity, bladder size, the skin for burns, blurry, color, warmth, moisture, pressure shows and puncture marks if there is, may narrow the diagnosis to a particular disorder. It will help for the treatment. Laboratory assessment. Laboratory assessment may be helpful in the differential diagnosis of poisoning. An increased anion gap metabolic acidosis is a characteristic of advanced methanol, ethylene glycol and salicylate intoxication, but can occur with other agents in any poisoning that results in hepatic, renal or respiratory failure, seizures or shocks can be seen. Radiologic studies also be useful of diagnostic purpose for pulmonary edema, respiratory distress syndrome or ARDS, adult respiratory distress syndrome, can be caused by poisoning with carbon monoxide, cyanide and opioid paraquat, phencyclidine, a sedative, hypnotic or salicylate by inhalation of irritant gases, fumes or vapors of ammonia, metal oxides, mercury, or by prolonged anoxia, hyperthermia or shock. This all can be identified by radiological study. Then ECG, electrocardiogram. The electrocardiogram ECG can be useful to assist with the differential diagnosis and to guide treatment. Bradycardia and atrioventricular block can occur in patient poisoned by alpha-adrenergic agonist or antiarrhythmic agents, beta blockers, calcium channel blockers, even cholinergic agents like carbamate and the pesticides which are like insecticides, organophosphate insecticides, which will cause irreversible damage to the cholinesterase enzyme, and cardiac glycosides, lithium, magnesium or tricyclic antidepressants. These all can give a diagnosis by ECG. And analysis of urine and blood, and occasionally of gastric content of chemical samples may be useful to confirm or rule out suspected poisoning. Response to antidote. Some of the antidotes we can just test it actually. Like response to antidotes may be useful for diagnostic purpose. How? Here I have given only 3 examples. There are many. Resolution of altering mental status and abnormal vital signs within minutes of intravenous administration of dextrose. You can identify whether it is due to hypoglycemia. Naloxone, we can see the observation by means of naloxone injecting and we can find out if there is any response, then you can say it is narcotic poisoning. Flumazenil, you can, if you give, it is an antidote for benzodiazepine intoxication. So these 3, when you can diagnose this by means of dextrose, hypoglycemia, naloxone, you can see when you inject naloxone, you can see whether it is having an narcotic poisoning. Flumazenil you can give and as an antidote for if it is a response is there, then you can say it is by means of poisoning by means of benzodiazepines intoxication respectively. So but now the treatment simply not complete, is a general, that's why it's like a short we have given. General principle, treatment goal includes support of vital signs, prevention of further poisoning or poison absorption, enhancement of poison elimination, administration of specific antidotes, and prevention of re-exposure. This is the category which is needed. So specific treatment depends on the identity of the poison by diagnosis, the route, the amount of exposure, the time of the presentation relative to the time and the exposure, and the severity of the poisoning, knowledge of the offending agents and its pharmacokinetics and pharmacodynamics is essential. And during the pre-toxic phase of the treatment, prior to the onset of the poisoning, decontamination is the highest priority and the treatment is based solely on the history. What is the time? That is a pre-toxic phase. Immediately decontamination. No absorption will take place. The patient can be easily saved. The maximum potential toxicity based on the greatest possible exposure should be assumed. History. And however, high blood levels of agents whose metabolites are more toxic once it is absorbed, and when it is biotransformed or it is metabolites, then it is some of them are very toxic than the compound, than the parent compound, like acetaminophen, paracetamol. The product was very toxic. Ethylene glycol, the converted product is, the metabolite is very toxic. Methanol, the converted product, the biotransformed or the metabolite is very toxic, may indicate the need of additional intervention. Antidotes and dialysis is needed. So during the toxic phase, the time between the onset of the poisoning and the peak effect management. Peak effect, the minimum effective concentration, toxic concentration, the peak effect, dose and present in the blood concentration. So the peak effect management is based primarily on the clinical and laboratory finding. Effects after an overdose being sooner, peak later and last longer than they do after a therapeutic dose. So you can see that what is that? Once it is overdose, being sooner, peak later and last longer. So it's very dangerous than the therapeutic dose which they have taken. So the measures that enhance poison elimination may shorten the duration of the toxication or toxicity, enhance the elimination, and lesser the severity. It will lesser the severity if you enhance the excretion or the elimination. The intestinal dialysis and the repeated dose of active charcoal, absorbing charcoal, activated charcoal, is usually safe and can enhance the elimination of any poisons. Diuresis is also another in the treatment comes. Diuresis and chelating therapy enhances the elimination of a relatively small number of poisons, and their use is associated with potential complications. Diuresis, you can remember diuresis. Some examples, we can see this is a detailed procedure you have to study, but diuresis, instillation therapies can be added for in the treatment. Extracorporeal methods are effective in removing many poisons. What are they? You have to study individually the techniques, how it should be performed as a clinical pharmacist. Techniques commonly used for extracorporeal drug removal methods are hemodialysis, hemoperfusions, continuous hemofiltrations, continuous hemodiafiltrations can be performed. During the resolution phase of poisoning, supportive care and monitoring should continue until clinical laboratory and the ECG abnormalities have been resolved. Until then, you have to go for this extracorporeal methods in the treatment. Supportive care, you need to give sometimes respiratory care, not sometimes, usually respiratory care, cardiovascular therapy, central nervous system therapies, and other measures. What do you mean by supportive care? The goal of supportive therapy is to maintain physiologic balance until detoxification is accomplished, and to prevent and treat secondary complications such as aspiration, bed sores, cerebral and pulmonary edema, pneumonia, rhabdomyolysis, renal failure, etc. Respiratory care is, you can see, endotracheal intubation. You have to know about this procedure very clearly. Endotracheal intubation. You can see that endotracheal tube inserting into the mouth through the tracheal area, vocal cord and the lungs. So this is called endotracheal tube placement for protection against the aspiration of gastrointestinal content in a paramount importance in patients with CNS depression or seizures, as this complication can increase morbidity and mortality. Number 2, cardiovascular therapy as a supportive care. Cardiovascular therapy, maintenance of normal tissue perfusion is critical to allow for complete recovery once the offending agent has been eliminated. In hypotension, in unresponsive to volume expansion, treatment with norepinephrine, epinephrine or high dose of dopamine may be necessary in additional cardiovascular therapy. Central nervous system supportive care. Central nervous system therapies, neuromuscular hyperactivity and seizures can lead to hyperthermia, lactic acidosis and rhabdomyolysis with their attendant complications and should be treated aggressively. Other measures, temperature extremes, metabolic abnormalities, hepatic and renal dysfunction and secondary complications should be treated by standard therapies. These all supportive treatment. Prevention of poison absorption. This is the next point which should be considered. Prevention of poison absorption. 1. Gastrointestinal decontamination. This is an important topic, important questions. Essay questions separately they have asked about the gastrointestinal decontaminations, different types we have to study detailing. But here it is general gastrointestinal decontamination, whole bowel irrigation, cathartic salts can be used for elimination, dilution, endoscopic or surgical removal it may be needed in some cases, and decontamination of the other sites. Suppose if it is an external skin, decontamination of other sites also may be needed. So gastrointestinal decontamination means gastrointestinal decontamination, whether or not to perform gastrointestinal decontamination and which procedure to use depending on the time since ingestion of the poison. The exciting and predicted toxicity of the ingestion or ingestant, the availability, the efficacy and the contraindications of the procedures, and the nature, severity and the risk of the complications is needed to decide gastrointestinal decontaminations. So activated charcoal has comparably a greater efficacy for gastrointestinal decontamination. Fewer contraindications and complications is less when compared to aggressive, that is aversive and invasive than ipecac or gastric lavage, and is a preferred method for gastrointestinal decontamination is the most situation, that is activated charcoal. But that in detail we have to study about the gastrointestinal decontamination. And whole bowel irrigation also. Whole bowel irrigation is performed by administering bowel cleansing, solution containing electrolytes and polyethylene glycol, glytylyl or colite, oral or by gastric tube in the rate of up to 0.5 liter per hour in children and 2 liter in adults until rectal effluent is freely clear. Up to that, the whole bowl irrigation will help the poison which enter into the GIT. Even cathartic salts can be used. Cathartic salts like disodium phosphate, magnesium citrate, magnesium sulfate, sodium sulfate, or saccharides like mannitol, sorbitol promote the rectal evacuation of gastrointestinal content. Dilution by drinking 5 ml water intake per kg of body weight and water, another clear liquid, should be accomplished as soon as possible after ingestion of corrosive acid and alkali in the. If it is external, then also washing should be done. Endoscopic or surgical removal of poison may be useful in rare situations such as ingestion of a potentially toxic foreign body that fails to transit the gastrointestinal tract. A potentially lethal amount of a heavy metal like arsenic, iron, mercury, thallium, or agents that has been coalesced in the gastric secretions or bezoars like barbiturates, glutathamide, glutathione, heavy metals, lithium, mebromate or mebromate, and sustained release preparations also. Sixth one is contamination or decontamination of other sites. Decontamination of other sites, immediate copious flushing with water, saline and other available clear drinkable liquid is the initial treatment of tropical exposure. Exceptions include alkali metals, calcium oxide, phosphorus. Fifth one is enhancement of poisoning elimination. Multiple dose of activated charcoal, forced diuresis, alteration of urine pH, extracorporeal removal. In multiple dose activated charcoal, repetitive oral dosing with charcoal can enhance the elimination of previous absorbed substance by binding them within the gut as they are excreted into the bile, secreted by gastrointestinal cells, or positively diffused into the gut lumen, reverse absorption or enterocapillary exsorption. Forced diuresis and alteration of urinary pH. Forced diuresis and alteration of urinary pH, diuresis, and iron trapping via alteration of urine pH may prevent the renal reabsorption of poisons that undergo excretion of glomerular filtration and active tubular secretions. Number 3, extracorporeal removal. As we have discussed, there is extracorporeal removal like peritoneal dialysis, hemodialysis, charcoal or resin, hemoperfusions, hemofiltrations, plasmapheresis, and exchange transfusion and capable of removing toxins from the bloodstream. Other techniques, administration of antidotes, a full chapter you have to study in detail what are the different antidotes. Prevention of re-exposure of poison. Administration of antidotes, counteract the effect of the poisons by neutralizing them. Example, antibody antigen reaction, chelation, chemical binding or by antagonizing the physiological effect, activation of opposing the nervous system activity, provision of competitive metabolic or receptor substrate, prevention of re-exposure of poisoning, very important, advising the patient, advising the person, that is not to go to the place again. Or you can see the prevention and re-exposure. Poisoning is preventable illness, and unfortunately some adults or children are poison prone and recurrent or common. So adult with accident exposure should be instructed regarding the safe use of medication and the chemical according to the labeling instruction, and confused patients may need assistant. Pharmacist should assist with the administration of medication. Error in the dosing also should be advised properly by the healthcare provider, that means pharmacist, may require educational efforts. Patients should be advised to avoid circumstances that results the chemical exposure or the poisoning. I have taken some of the questions in Kerala University past health science questions from this lecture. In January 2021 10 mark question, explain detail about the general principle involved in the management of poisoning. 10 mark. So you should write all these parameters. Explain general principle involved in the management of poisoning. 10 mark question in July 2018. And they have asked again, discuss various general measures of management of poisoning relevant to the clinical toxicology. 10 mark in July 2022. And write notes on supportive care of toxicology. 5 mark in March 2022. So they have asked this type of general questions. So this is only a topic just for an introduction. We will see in the next classes. I will slowly I will upload according to the your syllabus of PCI and KUHAS, and questions also we can discuss what all the possible question they have asked, so that the student will be easy for them to appear in the final exam. Thank you for being with me.